next talk is going to be Clayton Naddell, who's going to be talking about rectal tubes and enemas contraindicated in patients with platelet counts less than 50,000. Clay.
Thank you. Hello, I'm Clayton Naddell. I'm one of the second-year internal medicine residents, and as always, I'm very honored to be speaking before you today. The origin of the question is, as Dr. Frieda mentioned, is the origin of a lot of these Mythbuster talks, I imagine, is on ICU rounds, where we're trying to get something done. And there's really kind of two clinical scenarios that kind of come to the forefront when you're thinking this. And one is, hepatic encephalopathy, and the other is like opioid-induced constipation in chemotherapy patients and patients with cancer. Here is actually our cottage bowel protocol policy, and I've tried to highlight some of the the salient points here about the platelet count being clearly stated. Noting again here that the references stated here, looking into those, there's no mention of the platelet count specifically being 50,000. Again, here's one of our order set for if you order the Cottage Bowel program, and again, it's highlighted here, multiple parts for the platelet count to be below 50,000. So, I mean, it's a reasonable idea, right? I mean, if your platelets are low, rectal manipulation can, it's a highly vascular space. It can cause bleeding. If you have low platelets, it could be troublesome. And there's evidence of enemas, rectal tubes, even the flexoceal, causing bleeding in normal platelets. When they talk about contraindications to those things, though, it's mostly no mention of low platelet counts, but more mention of people on antiplatelet therapy or anticoagulation. Researching this topic, I was kind of fascinated about the history of enemas, and so I kind of wanted to highlight how this has kind of been pervasive in in treatment for centuries and worldwide. So going from 1500 BC, the Egyptian Eber Papyrus, to India and the Ayurveda. For at that point, it was used for multiple different ailments, including acne, hypertension, sexual disorders, kidney stones. To the 17th century age of enemas, where King Louis was recorded to have more than 200 enemas in a year. Up to the early 1900s, when colon hydrotherapy became popularized with the publication of colonic irrigation by Dr. Russell in 1932. When you Google history of enemas, this is what you come up with, is a lot of images of different stages of history of people getting enemas. Lower left is the Aztecs, lower right is Egyptian, and then of course medieval times. So this is what I was hoping to find researching this topic. And this is for central lines, comparison of different platelet thresholds, transfusion thresholds prior to the insertion of central lines and platelets with thrombocytopenia. However, this wasn't that easy. So what I want to do now is kind of go through some of the reviews and articles I did find to point out what I could glean. This is review of transanal irrigation in adults. The paper mentions bleeding diathesis, not including aspirin or Plavix, is relatively contraindicated. No specific number for platelet count mentioned. This is the practice guidance on the management of acute and chronic GI problems associated with the result of treatment of cancer. And they all, again, mention thrombocytopenia. It's common in patients undergoing chemotherapy. They even go on to state that there's no robust data as to a minimal safe platelet count for safe therapeutic endoscopy. And then they kind of mention that, it's kind of cut off, but platelet counts of 50 to 80,000 might be a reasonable number to go by. Also pointing out that patients undergoing chemotherapy not only might have low platelet counts, but they'll have platelet dysfunction as well. The American Gastroenterological Association technical review on constipation, lots of evidence for enemas and laxatives and different types of laxatives and rectal tubes and things like that. No mention of appropriate platelet counts to do those. This is the National Comprehensive Cancer Center guidelines for palliative care for constipation. Again, going through, it's basically a bowel protocol, but if you notice right here at the bottom, use of suppositories and enemas with caution in patients receiving chemotherapy due to the risk of cytopenia. Again, there's, of course, this is all, evidence-based, and you go to the references at the bottom of this guideline, look through all those papers, nothing says an exact platelet count. This is the Lippincotts nursing manual for thrombocytopenia management. Again, avoiding administering rectal suppositories or enema to prevent trauma to the rectal mucosa. Here's the sources that they cite. And if you notice, some of the sources are the accreditation bodies for nursing institutions and hospitals. So there could be some kind of regulatory barrier that puts this platelet count in play. And it's almost the end of the talk. I just wanted to point out one reference on here that I didn't have to, I get to put a slide on. It's second to the bottom, thrombocytopenia in critically ill patients receiving thromboprophylaxis, frequency, risk factors, and outcomes. In this article, it's one of the references in the up-to-date article on just thrombocytopenia and management, and this is where they can kind of classify 50,000 as severe thrombocytopenia, or less than 50,000 as severe thrombocytopenia, where they kind of give you different kind of grades of thrombocytopenia, and they base that on just treatment of ICU patients. Patients with less than 50,000 platelets have higher incidence of bleeding events that lead to some kind of surgical intervention. No real mention of, and obviously, no real mention of enemas, platelets, rectal tube manipulations, and things like that. That concludes my talk. Any questions?
Well, you mentioned a little bit, but I'm wondering, what is the protocol on patients who are on aspirin, Plavix, anticoagulation?
Well, so I don't think we have I don't think there's anything in our cottage protocol for that, but in the literature we'll kind of say that it's not it's a relative contraindication.
Who wrote the cottage protocol?
I don't remember who, but so in doing this, I talked to kind of several people. I talked to Ms. Barkis is here, and I talked to Bruce Reed, the pharmacist, chief pharmacist kind of guy. And he kind of told me this is kind of just a guideline, and if he even went on to state, well, if you guys come together as a physician community and want to change the threshold, that he'd be happy to do so. So I think he was kind of mentioning that there's no real clinical trials to prove this number, and so I guess the point I'm trying to make is 50,000. It seems reasonable, but why not 51,000? Why not 49? Why not 20? Yeah.
So, to me, this is kind of the classic example of a myth. I don't know where it got started. No one seems to know. Nobody knows. We can't find any data as to where this came from. I don't know if this is even a pervasive practice in hospitals. I'm not sure whether it's a standard nursing practice or not. We weren't able to really verify that, Clay really did a pretty extensive search, I think a very exhaustive search perhaps, and still couldn't find really any data to support this policy that we have. So somehow this got started, and it's basically, in my view, a complete myth. I think that a few months ago, there was a talk on prolonged INR and doing thoracentesis and paracentesis, and as part of the research for that, there were some guidelines for platelet counts for doing those that were, 25,000, and that's for when you're actually sticking needles in people, not just a soft, flexible tube or a suppository. So to me, I think 50,000 is kind of a ridiculous cutoff, if you're going to have a cutoff at all. And probably it ought to be more of a relative contraindication. People should think about it, and be gentle and careful when they're doing it. But that's my personal view. So let's see what everybody else thinks. So is this a myth? Rectal tubes and enemas are contraindicated in patients with platelet counts less than 50,000. Anybody think that this is actually true? It's confirmed? Anybody think it's plausible? There's still some people think it's plausible. Should be a contraindication. So this particular patient on rounds had a platelet count of 48,000. So they didn't do it because it was less than 50. How many think this is busted? Yeah, I'd say it's busted. Busted.